All right, so I believe we're live now. Hello, Facebook. Thank you for joining us today. My name is Madeline Wagner. I am the Program Support Assistant for the Center for Pharmacy Practice Innovation, which, in case you didn't know, is who's bringing you this Lunch and Learn on the flu vaccine today. So thank you for being here, and thank you for to our panelists and our moderator for joining us. We're excited to host this conversation. So I'm not going to hold you up too much longer. I'm going to turn it over to our moderator, Ace Callwood, in just a minute, but just to give you a bit of an introduction for him. He is a VCU alum, so go Rams. We're excited to have him back here. And he is a facilitator, mediator, speaker over at Envoy. So go ahead, Ace, I'll let you take it away.
Madeline, thank you so much. Always good to be here. This is one of my favorite things to do, is jump into a CPPI conversation during the lunch hour, and appreciate everybody tuning in. We've got two incredible guests today talking about the flu vaccine. And one of the things I really like about this series is it's all about where a pharmacist fits in the grand scheme of our healthcare, taking care of ourselves and getting information about our health, the health of our families, and the health of our communities. And so highlighting how integral a pharmacist is to that process, I think, is something that I didn't know when I started moderating this series, and something I've certainly learned. So we've got two incredible folks to hear from. Carly Sadler from down at Walnut Hill Pharmacy in Petersburg, I just learned, and Sharon Gatewood from the School of Pharmacy. Thanks, both of you, for joining us.
Thank you for having us. I'm super excited.
I love it. So let's start with START. We're talking about the flu vaccine, which for me starts with the question, what is the flu? So Sharon, I'm going to head to you for that one. Tell me about the flu itself, and of course, why does it have its own season? Two things that I wonder about regularly, and I suppose it is the season. So talk to us about it.
So influenza, which we usually call the flu, is a respiratory virus. I think it's important because I deal with patients all the time that get it confused with the stomach flu, which is actually not a flu, but a lot of people, when you call it that, which is more of that stomach bug, vomiting, diarrhea, those types of things, this is more respiratory. And it actually is something that is like a cold, where you can have the body, the chills, fever, body aches, more severe, very contagious, and could last for a couple of weeks. I've had patients kind of explain to me that it feels like their fingernails hurt. They feel so bad, and they've just been run over by a Mack truck. So much more severe. As far as having its own season, typically the season runs from September, October to April or May even. And usually it fares better, the virus does, within the winter months, within the cold, dry months. Also, the other thing we know, when we're in the winter time, we tend to congregate more inside and more together. And so we share the same airspace, which kind of allows things to flow to each other a little bit easier. Not spending as much time outside too during the winter months. Not having that sunlight exposure, which is good for the vitamin D, for the melatonin. It will weaken immune systems slightly, even in healthy individuals, and so more likely to contract this type of virus. So that is the reason that you see its own season, and you don't really see it in the summer months here in this area.
So did I hear that right? Some people say they felt like they got hit by a Mack truck and their fingernails hurt.
Yep, that has actually been things that I have had patients say to me after getting over having influenza.
Man, all right, that sounds like a thing I don't want. And of course, I think you just kind of frame that. We congregate, particularly as the temperature drops. We're together more frequently in person, sharing all of our germs, etc. And that is how we start to see the flu or influenza start to kind of skyrocket, which is why we have that season with its peak. And of course, we kind of drop off as we start distancing from each other again. So talk to me about how that's transmitted. How's the flu spread? And I'll ask Carly to jump in on that one.
Yeah, so we already kind of touched on a little bit and being in close quarters and in the indoors, but specifically the flu spread through droplets, usually from coughing or sneezing or even talking. It's never fun when you have that happen while you're talking, but it can spread viruses. What happens is those around you can breathe in those droplets, and breathing in those droplets is actually what causes the spread. It can happen by touching, but specifically what's happening is you're touching the droplets that land on surfaces. So it's not necessarily that the surface is infected, but rather that the droplets got on a surface and then you touched the surface, which is why it's really important for us to clean with really good antibacterial and antimicrobial substances during these seasons so that we can get those droplets off of surfaces to prevent transmission in one of those ways. Places and activities that you probably should avoid, kind of going off of that, is really just avoiding close contact scenarios like we've talked about and like Dr. Gatewood talked about. So unfortunately, a lot of entertainment venues tend to pack up in the fall and the winter. So things like concerts and sporting events, when you think about it, you're really close together, and there's a really increased chance of catching the virus there because, like I said, those droplets, you have a lot of yelling typically happening or singing. So don't really want to push yourself too far there. And then similar to COVID, and we're going to talk about this a little bit more, the flu is also estimated to travel up to 6 feet. So kind of that social distancing rule still applies even with the flu. So if you can attend events that implement social distancing and mask wearing and, hand washing policies and stuff, that alone will help to prevent the spread of the flu some.
Okay. All right. So I'm going to jump immediately out of order from some of the questions that we talked about before we started this conversation. All right. So we've got flu season. A lot of what I just heard from both of you is similar to some of the language around COVID, right? Like how transmissions happen, how we mitigate some of that risk, distancing, thinking about wearing masks, of course, and we're talking surfaces and kind of aerosolized droplets spreading things. Have we seen that, particularly the past, 18 months, going on 24 now, have we seen like a drop in flu transmission because we're more distanced and wearing masks more than regular? Like, is there some connection between this globally traumatic experience we've had in a health pandemic and the repercussions of that on what you see around flu season?
So
it's kind of open-ended. I'll take it from either.
Yes, and I can jump in, and Carly, feel free to say what you think as well. So we did see a decrease in the last flu season in 2020, 2021. And I think there's a multifaceted reason. One, there was an increase in people getting the influenza vaccines, which is probably the best way, not probably, to prevent influenza, but also the mask wearing. Things were shut down. So those events that Carly was talking about with the big crowds and the screaming and the singing was not occurring. And so we definitely saw a decrease in numbers. We saw a decrease in colds. We saw a decrease in RSV, which we are now seeing that we are more back face to face and not as restricted. Some of those other viruses also increasing. So we did see a decrease, and I think there's for multiple reasons.
Great. Thank you, Sharon. Carly, anything to add to that? I mean, I saw you nodding as Sharon was giving us some thoughts on why we saw a decrease and then maybe even seeing that ramp back up a little differently. So I know as we were prepping, you were saying you're busy right now down in Petersburg. Talk to me about that.
Yeah, so I kind of have two different perspectives. So I was a 2021 graduate at the School of Pharmacy, and I had my internal medicine rotation right in the middle of November of last year. So I was in the middle of the hospital, and even on the more severe side outside of the community, there were way fewer hospitalizations for flu. It wasn't something that typically happens. Usually in internal medicine, you're at least going to have a few flu tests come back positive. But it, for the most part, was very quiet. And in healthcare, you typically don't use that word. So it was very interesting to see. Coming into this season, we've seen, just like Dr. Gatewood said, an increased rate of vaccination. So Like I had mentioned with you beforehand, we're doing walk-ins for flu, shingles, as well as pneumonia vaccines and Tdap if you need it. So we've seen a lot of people not even just coming in just for that flu vaccine this year, but all of their chronic vaccines and their management vaccines to keep them healthy through the whole season, not just towards this one virus, but some of the other things that could happen as well. So less of just increased rates of flu vaccination, but increased rates of, I would say, activity with one's own health. We're seeing a lot more health maintenance right now.
Great. Thank you, Carly. So I want to jump into the vaccine and how it works and what it does and why it's good for us. But before we get there, I want to head back to Sharon for a quick, my interest is piqued and see if we can assuage my curiosity. Are there long-term repercussions to getting the flu? Long-term consequences of getting the flu beyond Mack truck and fingernails is what I continue to think about now.
Medical terms.
Mm-hmm.
So when we think of long-term complications with the flu, we probably do start to think about COVID, and not to keep bringing that up, but we are seeing a lot of long-term complications with COVID. But with the influenza, a lot of the times the complications where it could go into pneumonia, it could go into other respiratory conditions. Where we see some of the long-term things is patients, whether it's the elderly, because they do have a lower immune system, maybe people that have chronic conditions like congestive heart failure, asthma, or other lung conditions, or they're on medications that can weaken their immune system for other chronic conditions. And we do see some lung damage from that because they are not able to get rid of this virus as easily as someone who doesn't have these conditions. And so it hangs around longer, causing more damage. There are rare reports of neurological complications that people have. Tends to be more in pediatric patients, but that can be there as well. Overwhelmingly not as much as we're seeing with COVID, but yes, it is there.
Okay, that's helpful. So it's really, I mean, we're talking about folks who have some pre-existing conditions. As our immune system gets compromised, the thing can stick around longer and do some real damage. That is the layman's version. I'm not a doctor. I just play one on Zoom. The ACE paraphrase version, if you will, is getting the flu can leave its lasting mark in some cases. And so that leads us to how do we mitigate some of that risk? And I want to jump into the vaccine. What does the flu vaccine do first and foremost, before we get to how we got here and when we should get it? Just what does it do for us? Carly, I'll head to you for that.
So this one is a common misconception. A lot of people think that the purpose of the flu vaccine is to prevent getting the flu, period. So the analogy I like to make to my patients is that getting the flu vaccine gives you an army of soldiers, and those soldiers are your antibodies. And anytime you have an army of soldiers, there's still a chance of invasion. There's always a chance that something could get in, but it's going to turn out way, way better if you have that army there ready to fight for you. So what you have is not necessarily a prevention of getting it, although it does lower your risk of getting it, but a prevention of serious illness and hospitalization or even death. So we're really preventing those consequences that Dr. Gatewood previously talked about. So even if you do get it, similar to the COVID vaccine like we're seeing, you have way less of a chance of those long-term side effects.
So we're talking insurance policy here, right? I'm going to Geico, and it doesn't mean I won't get in a car accident, but if I do, I've got some protection and some help there if I get into a pickle. Does that I see you nodding, that feels like an appropriate analogy in some respects. And so really we're onboarding, as you said, that army to make sure that we are taken care of if, for instance, we happen to get the flu, but there's a little bit of lowering of the risk there as well. Is that fair? Appropriate?
Absolutely.
A nod from Sharon as well. All right. I am passing pharmacy school right now, it would seem, or I'm not failing at least. I'll take it. Cool. So we got what the flu does. Some people say the vaccine's ineffective. Why is that? And what would you say to them, Sharon?
Well, first and foremost, I try to say to everyone, no vaccine out there is 100% effective. And that's any of them, whether it's childhood vaccinations, routine adult vaccinations, travel vaccinations. But I think Carly laid it out really well as far as what it does. But
Hey,
you
Sherry, can I jump in? There's a word you used that I want to latch onto. You said
Sure.
effective, and I think we perhaps conflate efficacy with prevention, right? And Carly alluded to that, but can you expound a little bit? Like, effective means if you get the flu, it is less harmful. Like, I guess that's a question. What are we
Yes.
talking about when we talk about efficacy? Because I think we get into trouble there as a society, right?
So with vaccines, what we're talking about is how well it matches up to prevent, because vaccines are prevention. That being said, with the flu vaccine, depending on, because they determine what the strains are going to be in the flu vaccine based on the prediction of what they think is coming around the world. And they look at that and decide what they're going to do months and months in advance. And so sometimes it's a really good matchup, and sometimes it may not be as good because viruses do mutate, they change. And so when you look at effectiveness, a lot of times it's anywhere from 40 to 60% of a matchup, depending on the year. But if you get a different strain, or if you could still get a different strain or even the same strain, it's going to still weaken the severity and the duration of how long the virus lasts. So it's still important, even if it's not a matchup, that it is still going to have some protection to prevent those hospitalizations and that severe illness. Does that help explain it?
I think so. So let me make sure I got it. In a perfect world, the perfect vaccine, we take it, it makes sure we don't get the flu. But what you're saying is vaccines aren't perfect. We don't know what mutations or what strains are going to head towards us. So we're trying to predict that. And we design a vaccine that hopefully mitigates as much risk as possible, but rarely do we get to 100%. Even so, it sounds like if we've done the job well in rolling vaccine out for any given flu season, we at least mitigate the risk of having some really serious complications from the flu, even if it's not 100% preventative. Is that right?
Yes.
All right, we'll take it. All right, so that's really helpful, because I feel like a lot of the conversation is like, what's the point if it's not 100% going to prevent? And like, we'd like to be at 100%, but we're not always. Even so, just because it's not preventing doesn't mean it's not mitigating the risk of long-term repercussions. And like, I feel like we miss that second half when we talk about vaccines. It's kind of all or nothing. And that's not how medicine works. Like, we're just trying to lower risk of particular things as we think about care and how we go about it. So that is really helpful for me, hopefully for the folks at home as well. Cool. All right. So, in talking about the vaccine, one of the things that comes up is like, are we giving ourselves the flu to prevent the flu? Can you get the flu from the vaccine? Like, how does that work? Talk to me about some of the mechanics there.
Absolutely not. So I think it's important because we get this question all the time, that you hear people saying, well, I know this person that got the flu from the flu vaccine. So you can have an immune response to any vaccine, not just the influenza vaccine. And unfortunately, a lot of times we call it the flu-like symptoms that they have. It's very short-lived. At most 24 hours, you have body aches, potentially a low-grade fever, and it's your body mounting that response to the vaccine, building up their immune system or their immune response. Most people don't even have it, but some people do. And this is not the flu. This is just an immune response. And so, no, you can't. So of the vaccines that are available, the majority of them that are in, or all of them that are injections, are an inactivated or a dead vaccine. So there's no way to actually get the virus from the vaccine. There is a nasal spray, which is a weakened form of the virus. But when you look at who that's recommended for, because there's age limits and it has to be a healthy individual, can't have chronic conditions, can't be pregnant, can't have weakened immune system, those people should be able to mount a response and not get the flu from the vaccine either. So no, you cannot.
Okay, all right. My understanding, at least, and this is quite literally looking at your notes, as I'm getting a better understanding, there are a couple types of vaccines out there. So can you kind of walk me through how we made the vaccine in the first place?
So this is kind of a complicated conversation just because there are a lot of different ones out there. The easiest way to first explain it is you have the inactivated or the dead vaccine, which is the injection, or the flu mist, which is the live. How most of the
And so
inactivated
can I jump in? What do you
vaccine.
mean by live and dead?
So it's dead, meaning it is inactivated. The virus is not live. You can't get it, but it allows your body to mount that response.
Okay.
So the way they make that one, and most of them, is through hen eggs, through chicken eggs. And they
Okay.
actually cultivate the virus and allow it to replicate and then pull it out and kill it. They actually kill the virus and then take the antigen from there, put it in the vaccine, which mounts the response in your body. And so that is the main type. The problem with that one is if people for egg allergies, for instance, can't get that vaccine. They have since have a cell-based one, which is made not in chicken eggs, but more mammalian type eggs. So it's a little bit different. And then they have the recombinant vaccine, which the recombinant technology is a synthetic way that they make the vaccine. And they have other vaccines they make that way as well. But it has nothing to do with eggs. It mounts just as good of a response. And so there are multiple different options out there, depending. They are all quadrivalent, which means they have 4 different strains of the virus, 2 influenza A and 2 influenza B. And then you have the flu mist, which is a live vaccine, again, weakened form of the vaccine. So you still cannot, your body should be able to fight it off. It should not be a problem. It's people ages 2 to 49 that are healthy. So no chronic lung or heart conditions, no immune problems. As I said before, can't be pregnant. And you give it as a nasal spray and it replicates like the real flu does in the nasal passage. Does that help explain it and break it down?
It does. It does. So basically, we are taking a tiny bit of this vaccine, or excuse me, a tiny bit of the virus, and we're saying, hey, body, this is what this thing looks like. So if you at some point catch this thing, you'll already have been introduced to it, you know what to do with it, and can fight it off. And so a couple ways to do that. If I got it correctly, we've got one that we kind of make in chicken eggs, and for folks with egg allergies might have an issue with that, but we've got some that are made in cells, kind of outside of the chicken egg realm. And so we've got an option there. And then there's a synthetic version of the vaccine. And again, there's some guesswork in trying to figure out what strain of virus is going to end up in our location, in our geographic region. But we've got vaccines now that can kind of account for a couple different variations and just make sure you've got some introduction to the virus before it's problematic. Is that?
That is a fabulous summary. Yes.
Okay. All right. I'm feeling good about that. I want to take a quick detour because we're in a really interesting time societally where we're talking a lot about vaccines. I know we're talking about flu vaccine in this conversation, whereas the COVID vaccine is a big concern for a lot of folks. And so one of the things you just touched on here is that with the flu vaccine, in some instances, we actually do introduce a little bit of flu, right? And like just a tiny bit, enough to, like I said, introduce you. Whereas the COVID vaccine operates differently, right? We're not actually introducing any virus on that front. And I want to make that distinction like as clearly as we can. So anything to add to that, lend to that, and make sure we're steering folks in the right direction for the flu, but not in the wrong direction when it comes to COVID.
No, I think that's very good. And I think it's, again, make it clear that you're not giving them the flu. What you're doing is giving them enough, and you're right, with the COVID vaccine, we're not giving them COVID, but allowing their body to mount a response so that if they were to get the viruses, they would recognize it and be able to defend against it.
Okay, Great, great. So on the flu front, particularly as we were talking about the Dead versus Live, like we've killed the flu and we say, hey, this is what it looks like. And on the COVID front, we've created something that looks a lot like COVID and said, this is what the thing looks like. If you see something like this that is actually COVID, go deal with it. But like a different approach to how we are thinking about vaccines. And quite frankly, like we've created something pretty incredible on both fronts. With respect to the flu vaccine, we've been doing this a long time, yeah? I mean, most of us who have gone to public school, if not all of us, have gotten some flu vaccine at some point. It's been around a long time, and we've gotten pretty good at planning for each season and various strains at this point. So we're kind of pros at flu vaccine, if I'm hearing you both correctly. All right, for the sake of public safety and comfort, wanted to put some of those things out there and make sure we all feel good about how that's happening. If you have questions, those of you at home tuned in, feel free to drop those. I know Madeline is keeping an eye on chat. If we haven't explained anything well, feel free to dig, prod, ask some questions, and we'll see if we can't get that answered, because that is why we're here. We haven't heard from Carly in a little bit. Carly, I'm heading back to you. Who should get the vaccine? I know we just talked about kind of an age range of people who don't have any health conditions, but talk me through when I should be thinking about it, who should be thinking about it, loved ones that I want to take care of, like who should get protected?
Yeah, so there are very few people who shouldn't get the vaccine, unless you have a contraindication, such as a previous reaction to receiving the vaccine or an allergy. And even like Dr. Gatewood said, there are numerous different vaccines that we can offer, even if you do have an allergy. So really, there's not many people that shouldn't. So with that being said, you are going to look at some of the more serious illness populations. So like chronic illnesses, we had mentioned that before. We've seen in heart disease, diabetes, COPD, and chronic lung disease that we have lower rates of events that require hospitalization when you're vaccinated. So that's looking at your likelihood when you have those different diseases of having to be admitted into the hospital for care, just based off of whether or not you receive that vaccination. So I feel like that's a pretty easy choice to make when it looks at a risk perspective. And then pregnant women's another big population that's highly controversial. They also have a decreased risk of hospitalization like those groups. So we've also found that that vaccine will pass through the mother to the baby as well and start to provide some protection to the baby, even into that first 6 months of life, which then the baby can be vaccinated once they reach 6 months. So a big benefit in that group. And then finally, just like you mentioned, public schools are children. So they not only prevent severe illness in the kids, but also help to decrease that risk of transmission in schools. And as we know, schools are tightly packed. So we have a lot of transmission that happens there and then comes home to the mom or the dad or the grandparent and ends up having some of those longer term side effects that we could have kind of mitigated in the school system with our kids.
Okay, so I'm hearing just about everyone could benefit from getting the vaccine. And there are some particular groups, those with chronic illnesses, pregnant women, and of course, the kids who are scurrying off to school and, just swapping germs left and right. So there are a couple populations that would very much benefit, but on top of that, kind of all of us would. And it sounds like there are a couple options, and Sharon alluded to this. There are a couple options for what type of vaccine we can get. And so if you've got allergies or concerns, there might be a version that works for you one way or another. Anything to add there on the who should, how we should think about it? And then on top of that, when is the best time? Is it like at the height of flu season? Is it prior to? When should I think about timing on vaccine?
So typically you're going to look at that September to April or May season, just like Dr. Gatewood had talked about. You're going to want to wait closer to that September to October time period because you do want the vaccine to last for the full season for you. So I typically recommend for families to get through their summer vacation in August, get back home comfortable, good, and right around that start of the school year time as you're getting back settled into your routine, go ahead and add that to your routine for the fall.
Great. Okay. Well, that is very good to know. I feel like I missed a question in here that was really important. So I'm scanning back through my notes and making sure I didn't miss that. Otherwise, we'll jump back into kind of a COVID-related conversation. We've got now a couple vaccines floating around that are probably good for public health. Is there any interference between particularly the flu vaccine and the COVID vaccine if you're going for first go round or kind of coming up on booster? Like, are there any concerns I should have about both of those happening in the same kind of time period or time frame?
No, there isn't. When the COVID vaccines first came out, they were having us space them out 2 weeks from any other vaccines. And that was simply because they didn't really have the data to know if there was any interference. But now that is no longer a recommendation. And really and truly, there are certain vaccines you should space out, but these two are not one of them. If they want to get them together, whether it's a booster of the COVID or their first one, it is completely fine.
Okay, all right. So I could get them on the same day. I mean, one arm, the other arm, like knock them out and then go back to living is what it sounds like. And I've got an emphatic nod from Carly.
And absolutely. I mean, we always ask the patient if they have an arm preference, but there does tend to be more arm soreness with the COVID vaccine. And so they may want to get them in two separate arms, or they may just want the soreness to be in one arm, and that's fine too.
All right, so I'm gonna take a quick detour on this one. Vaccines in arms. I know you all ask what the preference is. Is there upside to, like, some people say the dominant arm because you're moving it more, and the pain like subsides. You've got your muscles moving, and some people say like put it in your off arm. And any guidance there from the pros who see this regularly? This is not a planned question. I'm putting you on the spot, but now I'm curious.
But we get asked all the time, so that's okay. So I always tell them to do the dominant arm, but I also leave it to their preference, because you do move it more. And the reason it's sore is because it's sitting there in that muscle, in that deep muscle, and you want to work it out. But there are some people that still prefer to have it in the non-dominant. There's no right or wrong there. It may be a little bit sore. Obviously, certain situations, people have to have it in certain arms. If they've had lymph nodes removed or a mastectomy or something along those lines, or something else that the doctor has told them not to have things done in that arm. But typically patient preference, but I do tell them that if asked.
Okay, thank you. I'm going to stay on my tangent for another quick second, or my detour, if you will. Does pain around a vaccine site, does soreness mean anything about efficacy or the thing working? I hear that pop up a lot as well. This is like Mythbusters pharmacy edition, I feel like. Anything that our body's telling us except for you just had a needle stuck in your arm?
Yeah, unfortunately, not necessarily. A lot of times there's a lot of factors that go into that soreness. So when you think about it, there is the needle going in the arm, there's the muscle, there's, just like Dr. Gatewood said, how much you move it throughout the day. And really at the end of the day, what it comes down to is you had something foreign injected into your muscle, and then your body's trying to figure out what it is, what to do with it, how to react to it. And that's really all it is. It's not necessarily if you have a stronger immune system or a more weak immune system. It really boils down to just your body reacting to this foreign substance.
Great, great. So we just gave our body some new instructions. It says, hey, if you see this thing, do something with it. And then like, it's just getting up to speed, figuring out what those instructions are and how it responds to them. Okay, very, very helpful. I'm going to stick on COVID a little bit longer. Is having COVID around right now going to make this flu season more dangerous? I know we talked a little bit about just like by virtue of being away from people, we have seen a lessening of the impact of the flu season, but like, are there any dangers that come with flu and COVID floating around at the same time? And I think I'll look to Sharon for that. Yeah, thank you.
Yeah, so dangerous, it's hard to say because we're not there yet. And as I mentioned already, last year, the flu activity was extremely low due to vaccination rates, due to masks, due to not being able to get together with groups of people. And we're a lot less restricted now. And so, can you get both at the same time? Absolutely. There's no reason that patients can't. And so it's hard to say whether one's going to affect the other, but they definitely are going to probably both flourish a little bit more this year, having less restrictions. People are still wearing masks, just not to the point that we were.
Okay, all right. Carly, I'm going to head to you for a follow-up. If on the chance I get both COVID and the flu at the same time, is that a major issue? Like, talk me through what that might look like.
Yeah, so anytime you catch any type of virus, you're putting yourself at an increased risk of not being able to defend yourself from other things, both bacterial, viral, whatever it may be. So just by contracting the COVID or the flu virus, you are already putting extra stress on your body and increasing your risk of contracting the other one just by catching the first. So I like to lead with that. Once you do contract both of them at the same time, it puts you at an increased risk of some of those more severe complications, like a severe lung infection. And then you're looking at some long-term lung damage and some of those things like we've heard about, like long COVID. So nothing that we really can't prevent right now just by getting both of those vaccines. And then we already talked about chronic illnesses some more. We're going to see an increased risk of those being exacerbated. So we think about our asthma patients, our COPD patients. We've already talked about diabetes and heart disease. Having lung complications in general is not a good thing, but especially for these populations whose lungs already need a little extra help or may already be on some type of maintenance therapy to keep their lungs stable, you're putting them at an increased risk of having long-term side effects just from the virus. And then finally, we typically think about sepsis with bacteria, but you also, when you have both of them, can see a viral sepsis picture, which could ultimately lead to like something more severe, even death. So that's where you're really going to want to prevent that long-term organ dysfunction, keep the brain, keep the heart, keep the lungs healthy, just by making sure that you prevent both of those illnesses.
Right. So what I'm hearing is COVID and flu at the same time is not, there's no value judgment on that. It's not bad for the sake of, but like there are some external factors and of course some increased risk if we've got any two viruses at the same time, if we've got any one virus at any given time. And so the factors we talked about, those higher risk groups, are just that, higher risk groups. And in a perfect world, avoiding either virus, certainly both at the same time, is ideal, which is, I believe, why we're talking about vaccines today, I would imagine. So we're mitigating risk and we're trying to prevent what we can prevent, or as you know, a phrase I use often, a phrase I learned working for the Army: control what you can control and influence the variables. We've all got an opportunity to mitigate a lot of risk with a vaccine, is what it sounds like. And I think this is really helpful info that we're getting from both of you today. So I appreciate you making time. So I just got a really good rundown of potential risks. Outside of vaccine, what else can I do to prevent myself from getting the flu? And I'll head back to Sharon for this one.
So like a lot of other viruses, I mean, the same things, but first and foremost, get vaccinated. That's actually the best way that you can prevent or decrease the severity and complications, as we've talked about with influenza. Wearing a mask will help. It will help reduce, as I said, last season, 2021, we saw a decrease in all kinds of different viral things. Washing your hands, absolutely washing your hands. Carly had talked about, it's not that the surfaces are contaminated, but you touch that from people sneezing, coughing, what have you, and that's how it gets transmitted. Cleaning things. So all the things that we've been preaching for the last 18 months regarding COVID prevention, even before we had the vaccine, very much plays into a part here. Getting enough rest, having a decent diet. You know, not getting enough rest puts a ton of stress on the body and weakens the immune system as well. Exercising helps also. So there's lots of different ways to help boost that immune system and hopefully prevent. But vaccination is the best way.
All right. So you heard it here first. Get vaccinated, folks. But a lot of what we're doing and have been doing around COVID has been really helpful. I would imagine, Sharon, I'm looking back at you, I would imagine that is why we have seen the virtually no flu season last year. And if I heard you correctly, you mentioned like, hey, we're wearing masks a little less and we're like laxing a bit on our COVID restrictions, which means we might see flu season return in a way that we're used to rather than kind of the anomaly of last year. Is that right? We may see kind of an uptick this year?
We very well could. It may not be, the highest numbers ever, but I definitely think we're going to see more than we saw last year. Yes.
Okay. And Carly, anything to add on that prevention wise? I know we just got a pretty good list. Anything you've seen or would recommend?
I think we've covered all of it, just reinforcing for another time vaccination, but also, like we said, hand washing, cleaning surfaces, making sure to at least put your due diligence in to stay distant, even if you are going to some of those events or family events this year. And just being mindful of your surroundings and mindful of your habits and your cleanliness in your surroundings, just to ensure that you're safe.
All right, so all of the songs that we made up about washing our hands, we should still keep singing those, and we should think about masks and hand sanitizer and all of the things that we've gotten probably more used to than we would have cared to over the last, like I said, 18 months. What if the flu sneaks in despite all of that? How do I mitigate some of the pain? How do I avoid the Mack truck and the painful fingernails? If you take one thing away, it's those two things, Mack truck, fingernails. How do I avoid that if I happen to get the flu, or are there ways to mitigate some of the effects?
So it's important because there are a lot of different things that are going to be swirling around during this time. So to get tested, to make sure that you know from your doctor or your pharmacist to know if you actually have influenza. That being said, there are antivirals that can come into play if you do get the flu, but it really is a short window. It needs to be within 2 days, 48 hours of your symptoms starting. And what it does is it lessens the duration and the severity by 1 or 2 days as well. It's not going to completely get rid of it, but it may be something that could help it make it a little more palatable. So a lot of times it's more supportive therapy for the symptoms, whether it's treatment for the cough, treatment for the fever, the body aches. So taking those types of medications for those symptoms to kind of help as well. And as we talked about, getting enough fluids is really important because with fevers and stuff, you're at risk for dehydration. And so that's a really big deal, along with getting rest. Because that's where your body's energy is restored, as well as the immune system to help fight it off. So getting that energy back. So it is important to follow those types of procedures that your physician or your pharmacist gives you when this occurs.
Okay. Talk to me about the flu test. What is that? I know we're all used to COVID testing and things up our nose and all of that discomfort. I couldn't tell you that I remember what a flu test is like. So how does that work?
It's actually very similar to the COVID test. Both of them replicate in the nasal passage. And so that is the reason for, as you so eloquently put, things up the nose. That is how you test for it. And that's where it replicates. Some of the COVID tests are the same way because some of them are approved where you can not go so far up the nose that it's uncomfortable. But it's a quick swab a lot of times, and then a quick test in the doctor's office, and they usually know within 10 or 15 minutes whether or not it's positive.
There we go. So that is the official term for a nasopharyngeal swab, is up the nose, deeper than we'd like. And can you give me some more context on timeline? So let me make sure I heard what I heard, and then like a question that is percolating for me is, how do I manage between flu and COVID, right? So what I heard is you kind of want to start on a regimen to mitigate some of the potential repercussions, 1 to 2 days after symptoms appear. I would guess, and tell me if I'm wrong here, I would guess you'd want to know if you have the flu before you start kind of treating for the flu. And then the COVID timelines are a little different. We're a couple days out from potential transmission, and then we want to get tested kind of in a window where we know if we'll have an effective test, or we'd be more likely to have an effective test. And if those timelines are off a little bit, like what if it maybe feels like I have COVID, or maybe feels like I have the flu? I want to get tested as soon as possible, but I've got to wait a little bit for COVID. Like that seems kind of messy. I don't know if there's a good question in here, but like, give me some help to better understand how I should navigate COVID, flu symptoms, wait it out, get tested early. Like, talk me through that.
Yeah, so one of the many benefits of the pandemic in healthcare is going to be telehealth. So we now have the ability to face-to-face see providers, whether it be our physicians associates, physicians, nurse practitioners, pharmacists, whoever it may be, and they can help to kind of guide you through those symptoms as well as guide you through your exposure likelihood. They'll be able to kind of distinguish with you based on whether something happened 1 to 2 days ago versus 3 to 5 to even 10 days ago, whether it looks more like a COVID picture or a flu picture. Either way, it is pretty safe to say that if you start to have some of those symptoms, including a more severe cough or a fever, anything like that, go ahead and reach out to your healthcare provider. That way they can make the determination of whether or not you should get a COVID test. But I would recommend quarantining as if it is COVID, just to be safe either way.
Okay, I see Sharon nodding along as well, and that's really helpful. So kind of act like it's COVID as in if you start to feel symptoms, and then of course the telehealth piece, which you're right is one of the kind of hidden upsides of a thing that again has been traumatic for a lot of us. I get that, but we are. I keep saying about COVID, I hope our memory is long. Like we learned a lot throughout this process. And telehealth is one of the things. It's like, hey, you don't need to come into the doctor's office or go see your pharmacist in person. Just ask a question. Can we do that a little better? It sounds like this is one of the benefits is, yeah, you can ask and you can walk through. And I think I heard the phrasing, a COVID picture versus an influenza picture. Like given the data we have, we can aggregate that and say, hey, this looks like you should get tested for. And a pharmacist, back to one of the reasons this series, this Lunch and Learn exists, is like your pharmacist can help walk you through that. Doesn't have to be go to your primary care physician. You two here and a lot of the folks we've talked through this series have a lot of the same information on, yeah, you ought to think about these next couple steps. I got nods. I like that. Nods are good. We've got about 10 minutes left, and I'm going to kind of look to the audience. I can't see the audience because I don't have Facebook in front of me. I'm just screaming into the void, into the camera here in front of me. But if you have questions, if you have thoughts, if you had a question that I almost asked, but I butchered it, and you'd like to ask it better, feel free to jump in the mix, send a comment or a chat, and Madeline will make sure we get that. And I'm going to turn back to Carly and Sharon and ask if we've got kind of any loose ends to tie up, any threads we haven't fully pulled, any last thoughts as we've got a couple minutes left together.
So one of the things I did want to mention, because this kind of surfaced with the COVID vaccine when that became available, and it's kind of extended a little bit with the influenza vaccine. There's been a lot of questions about if someone is positive for COVID or if they think they have COVID, can they still get the flu shot? And so technically the answer is yes, they can. But if they are in quarantine, we do have them wait. And the big reason is because of exposing the healthcare team, the pharmacist, whoever it may be. It is not because there's an interaction with having COVID and the influenza vaccine. It's more just kind of spacing out, keeping that distance until they're out of isolation. So I think that's important to explain that there's not an interaction, like I said, but more of that quarantine time and they have to be isolated.
Okay, all right. So it's not about the interaction. It's just about keeping our frontline workers and healthcare providers safe by not bringing in a potential COVID case in the interim. And so back to that telehealth thing, like we can do a lot of the initial consults, the chats, the check-ins virtually. We should be leveraging that a little differently than we did before. Great. Thank you. Carly, anything to add to that?
Mine's kind of on a different topic, but also going on that interactions scenario that Dr. Gatewood mentioned. A common question that I get out in the community is typically, should I not take my medications prior to getting the vaccine? Whether it be flu vaccine or COVID vaccine, I will get asked if their blood pressure medication or cholesterol medication interacts. And I always recommend to still take your medications that day. Your pharmacist or your physician, whoever's helping you, will be able to go ahead and look through all of your medication list with you and really decipher if there's any contraindications to receiving the vaccine. But that should be discussed ahead of time. Otherwise, go ahead, take your medications as you normally would.
Okay, all right. Another place that pharmacist steps up to the plate and really helps out here. Like, you can audit all of the medications and make sure there's nothing that's going to have an adverse effect, but it's the right question to ask. And I think part of doing these sessions is saying, hey, we know who we ought to be asking. Oftentimes, particularly around medication, it's our pharmacist. So that is very helpful. I wouldn't have thought to even dig into that, and I appreciate you bringing it up, Carly. All right, so with a couple minutes until the top of the hour, I think we are questioned out. We've gone through quite a bit today. For the folks at home, appreciate you all tuning in. And of course, to Sharon and Carly, thank you for tuning in. Thank you for joining. Thank you for lending all of your knowledge and insights to the folks at home. Madeline, anything for the wrap up, or should I hand it back over to you to close us out?
I think that covers it. Thank you all so much for being here today. And thank you, Ace, especially for moderating. This is a fantastic conversation, and I'm excited to see how many people are able to help with it. I think you all covered a lot of information that, I, as the representative for the public helping to draft these questions, thought of, but then a lot of things that I didn't think of, that I don't deal with. So thank you so much for bringing your expertise and really giving us the information we need at the level we need it. So
thank you for having us.
Yeah. I believe that's it for us today. So thank you to those who tuned in. Thank you to those who spoke, and we'll see you next time for our next Lunch and Learn. Bye, y'all.